Hey everyone, Dr. Scott here with Caledonies Family Chiropractic. Today's video, I want to talk a little bit about sciatic nerve pain and what you can do at home to help alleviate some of your pain and discomfort. Sciatica or sciatic nerve issues are a really common problem that create a great amount of discomfort, disability for many people, and there's a lot of information out there on what are the best things to do. To really get focused on the best exercises for you, you really need to understand the cause of your sciatic pain. What sciatic pain is, first of all, is compression on the nerve roots in your lower back, most often, sometimes pressure on the sciatic nerve as it goes through your hip and your buttock area. But it can create pain in your lower back, pain in your hip, down the back of your leg, especially on the outside of your lower leg, in your foot, maybe some numbness or tingling in your toes, and in bad cases, some weakness in your leg or trouble lifting up your foot as well. There are multiple causes, as mentioned, and understanding yours is important. There's disc herniations or bulging discs, there's degenerative disc disease, there's spinal stenosis, arthritic issues in your back, there's piriformis syndrome. We're not going to get into all that today. Important to understand for you what your cause is so we can give the best exercises. Today I'm going to give you some basic exercises that really, no matter the cause, I find are often helpful with many patients. As always, if any of these exercises are creating pain or discomfort, please stop. And really, you should talk to your healthcare provider before starting any exercise program to make sure that the exercises are right for you. Okay, so with sciatic nerve, we know the main issues are often compression in our lower back due to some sort of force, that's a disc or joint or arthritic trouble, as well as tightness in the muscles through our hip, and then things going down the back of our leg. So we often find it helpful to open the joints in the low back up and stretch the muscles in the hip. So really simple exercise program here that anybody can do, and most of it's done just laying down. So let's have a look. Okay, so one of the first exercises I always like to start with is a gentle knee to chest stretch, which really opens up the lower back, opens up the joints of the lower back, and will even take some pressure off the disc. So a lot of times we just take one leg at a time, pull your knee up towards your chest. I like to hold this for about 30 seconds or so, and we find that will let everything relax your lower back. So we'll do 30 seconds one leg, 30 seconds with the other leg, and we'll often focus on the leg that has the symptoms or the sciatic nerve pressure. After you've done, bring your knee up for about 30 seconds, then you can bring it actually towards the opposite shoulder a little bit, and that will give you a little more of a stretch through your glutes. So a lot of times I'll tell patients 30 seconds to this shoulder, 30 seconds to that shoulder. Pretty simple, pretty easy, and usually feels good for most patients. Some patients will find comfort in doing both legs at the same time. I don't mind that stretch, but just be cautious that it's not putting too much pressure on your lower back. The next thing we like to do is mobilize our sciatic nerve. So nerves don't generally like to be stretched, and if you have a bad case sciatic, you know as soon as you try and raise your leg up like this, it tends to pull pretty good through your leg and might even cause pain in your lower back. So a lot of times what we'll do is we'll have people keep their knee bent and grab behind their knee. Then we say bring your leg up until you feel a little bit of tension, not too much discomfort there, but just as it starts to hit that point. And for some people that might be here, some people you might be able to get up quite a bit higher. Then what you want to do is you want to use your foot in a pumping action. So if you look at my foot here, we're going to come up and then down, up and then down, depending, for a lot of people might be up a little higher. And we're just going to do this for about 20 repetitions or so. And what that does is it takes that nerve, and what we call glides or flosses it, just slides it back and forth. So anywhere it's getting pinched between muscles or even around a joint, it's going to start to slide and maybe free up that nerve a little bit. Often quite comfortable. At the same time, you're going to get a little bit of stretch through your hamstrings, which we also find helpful. Okay, the last exercise that I'm going to show you here is a stretch for your glute muscles or your piriformis muscle, where that sciatic nerve often gets pinched. What we're going to have you do is bring your foot up so it's crossing over the other knee. Then what you're going to do is you're going to pull your knee towards your opposite shoulder, and for most people that will give a little bit of a stretch through your hip or glute muscles. At the same time, while you're holding that, if you take your knee associated with your foot on the ground and push it over in the same direction, so we're pulling, in my case, towards my right shoulder and then pushing my knee towards the right side, that's going to increase that stretch. Loosening those muscles up will often help take pressure off the sciatic nerve. When it comes to sciatic nerve pain and the exercise that you're doing for them, there's a really simple rule that I like to follow. If doing the exercise or position or movement that you're doing takes pain out of your leg, that's generally a good exercise. It means pressure's coming off the nerve. Those are motions or positions that we encourage. If you're doing a stretch or an exercise and it's making pain, stronger down your leg or go further down your leg, that is generally a position that we try and avoid. So many of you may have heard things like McKenzie exercises or extension exercises. Some people teach flexion exercises. For some people that's going to help, and for some people that's not going to help. It depends what the cause of your sciatic nerve pain is. The exercise I've given you, I find for most people will help give them some relief, but it is really important for you to find out the exact cause or reason behind your sciatic pain so we can gear even more specific exercises for you to do at home. We're going to get into, in future videos, we're going to talk more about specific conditions and exercises for those, but start with these, and if you have any questions, as always, give our office a call. Our practitioners are always happy to help. Hope you have a wonderful day.